Let's dive into the discussions shaping the nation.
Agus the scanal eile ó hiú cuirim sláinte dá foiistí inar dír agus tíimiid ó tuairiscail neamhspleáit a fáil sé ag an dit go ábradí deanta ar na céta poiste sa tíir seo agus é réidirnis na ró na ábradí sin na taistil ufa tá seo scanala agus chuir isteach go mór ar tuismóirí agus na poistí seo. Minister, there are serious findings that unnecessary hip surgeries were carried out on hundreds of children in CHI hospitals at Kappa and at Temple Street. These allegations were originally made by a whistleblower who was reported in the media at the time. They further alleged these surgeries were conducted purely for financial gain. If true, that's absolutely shocking, and it would be a massive scandal. We're talking about children here, children that are between the ages of 1 and 7. It would be disgraceful for any medical professional to decide to put a child through the pain and trauma of surgery that wasn't necessary. Following whistleblower claims in a protected disclosure, an audit into paediatric hip surgeries at the 3 CHI hospitals was ordered in April of last year. The report has now been published in full on the Ditch website and can be read by everyone. It claims that hundreds of children who had surgery, the surgery was carried out on, that they didn't meet the threshold for that surgery. They were subject to unnecessary surgery, Minister. According to that audit, 561 children went through these hip surgeries since 2021. The audit has found that 79% of the surgeries at Kappa and 60% at Temple Street did not meet the threshold for surgeries. Minister, they were unnecessary. The report recommends now that all of these children should be recalled and independently assessed. So, Minister, imagine for 1 minute that you're the parent of one of these children who were operated on. Imagine the absolute horror of thinking that your child was put through the trauma of surgery that they didn't need. One parent who made contact with us, her daughter was only 4 years of age when she went through this operation. She received a letter from Kappa to inform her of the clinical audit and to these surgeries just a couple of weeks ago. She's devastated. She says she's sick to her stomach, Minister, that her daughter might have been operated on unnecessary. She says, "This is a horrifying situation to be in as any parent. My daughter was born premature and enduring lots of challenges in her first weeks of life. This was followed by treatment for hip dysplasia and now possibly resulting in a surgery that may not needed to happen." Minister, this comes less than 2 years after it came to light that unlicensed springs were implanted into several children at Temple Street Children's Hospital. And that scandal is still ongoing. External reviews and ongoing HICWA reviews for 18 months now, and we still have no answers, no interim reports that was promised at the time. And this all begs the question. When is this going to stop? And what is going on at Children's Health Ireland? And why is the government incapable of getting to grips with it when we hear scandal after scandal in relation to the children of this state? The allegations and the news of this audit were first put in train and entered into the public domain in July of last year. Surely, given the already established concern regarding practices at CHI, that these allegations should have been setting off alarm bells in government buildings, in the Taoiseach's office and in the Ministry for Health. These allegations should have compelled the government to step in directly to investigate and demand answers. And it raises big questions for the government, and the families who have been in touch with us want those answers. So what actions did the government take when these shocking allegations came to light first in July? Has the government established that if the allegations are true, was some of this motivated by profit? There are hundreds of parents out there, that are living a nightmare of worry. And have all of those parents been contacted? And crucially, the question they're asking is, when will they know if their child was operated on unnecessary or not?
Deputy.
Thank you very much, Deputy, for raising this very important matter. And I'm very conscious that before this report was made available, we had many families who were having very deep worries about surgery that their loved children may have undergone. We're raising questions about the need for us, the impact of us, and I know would have had their trust in our health service and in our professionals at least been questioned. And I'm also very conscious, as you raised this very important issue, that our nurses, our doctors, our consultants work very, very hard to provide the best possible care to those who are entrusted into their care, which is indeed, Las Corla, is why it is so vital that when issues are raised regarding the need for surgery, the need for any kind of medical intervention, what was the impact of it and why it occurred, that those issues are taken very seriously and that they are acted upon. And there is indeed, as Deputy Doherty has already acknowledged, a clinical audit that is now taking place in relation to this issue. And let me emphasise the reason why this audit is taking place is in recognition of the seriousness of this matter and in recognition of what it can mean for how families, their loved ones, trust and feel confident in health services that are designed to look after them and to support their health. That audit at the moment is being conducted, and I understand where that process now stands is the report is now being looked at. Clinicians are providing final input into it, and that final input will be available to the author of the report very, very shortly, if indeed it hasn't already been shared. I'm then certain that when that process is done, that work will be shared with the Department of Health, will be shared with the hospitals and those who are involved in leading them. And at that point, a number of further priorities will then become urgent. The first one will be to communicate very clearly to all families and their children who may have been affected by this, to share with them in a transparent and open way the conclusions of this report, acknowledging, of course, the distress, the worry that many face at the moment. And second then is to look at what further actions, if any, are needed to respond back to the consequences of any operations that may have taken place. And then thirdly, of course, at that point, and this will have been a core theme of the audit that will have taken place, we'll need to understand if and why this happened in the first place, and what indeed are the consequences of it, which the hospitals, the Minister and the Government will take as seriously as this House would expect. It is important to emphasise at this point in time that work at the moment is underway, and it's all about ensuring that any surgical practice that took place during that period is carried out in a way that is consistent with international standards and with the care that any family, that any child would expect when they are entrusting themselves into the care of our health professionals.
Deputy Doherty.
Minister, when these questions were raised by my colleague Deputy Kilnan to the Minister just a number of weeks ago, she said she hadn't seen the report, she hadn't read the report. It's only through the ditch releasing the report that now we can all see it. But that tells a story, in my view, in relation to the lack of urgency that has been placed in the government in relation to this here. That the alarm bells are not ringing on something that has been raised as far back as April of last year, in the media as far back as July of last year, and we now know from the report that is published by the Ditch, the independent audit, that 79% of the operations in Kappa didn't meet the threshold, 60% in Temple Street, hundreds of children potentially operated on that were unnecessary. A second family has come to us. They told us that a consultant was telling them that they needed an operation on both hips for their young girl. They thought something was wrong. They went and got a private second opinion. And you know what they were told, Pascal? They were told not only did not need the surgery, the child didn't even have the condition. Let that sink in. That is what is happening to the children of Ireland. And I say this, there is not enough urgency in government that is allowing this to happen, and it happens over and over and over again.
Minister
so when will the parents know whether their children is one of the children that were unoperated wrongly?
You don't need to remind us, Deputy Doherty, of the impact that this can have on families, and the impact that this can have on those who have been affected by the issues that are now being raised. We know how important it is to maintain trust in our health services, and particularly for our very youngest who are dealing or could be dealing with complex health needs, the need to ensure that they trust those whose care and expertise they depend on. What is equally important in dealing with all of this is that we assemble the facts in a clear and authoritative way, and we're in a position to communicate to those who have been affected by it when there's greater clarity on exactly what has happened. And that process is coming to an end. The report that you refer to, that has been published elsewhere, is now and has been assessed by the author who's involved in doing it. He has sought further clinical input.
Thank you, Minister.
When that report is then shared with the department and the work is concluded, of course, contact will take place in as comprehensive and in as honest a manner as is possible with all who fear they could have been affected by this. And I will underline again
Thank you, Minister.
the seriousness with which the government, the hospitals and the Minister take
Thank
this
you.
matter.
Like, share, and subscribe, and let us know your thoughts in the comments. We'd love to hear from you.